In this video, we'll be discussing the anatomy of the human heart in detail, including the external and the internal features. But first, let's discuss a few general characteristics of the heart. The heart is a conical, hollow, muscular organ situated in the middle mediastinum and enclosed in the pericardium. The heart has three surfaces, namely the anterior or sternocostal surface, the posterior or diaphragmatic surface, and the pulmonary surface facing the lungs. The apex of the heart is a blunt, rounded extremity formed by the left ventricle, and the base is formed primarily by the left atrium and only partly by the posterior right atrium. The human heart has four chambers, that is, the right atrium, the right ventricle, the left atrium, and the left ventricle, as indicated by the green arrows. The great vessels of the heart include the superior vena cava and the inferior vena cava, which bring deoxygenated blood from the body to the right atrium. The pulmonary trunk carries deoxygenated blood from the right ventricle to the lungs for oxygenation, and it divides into the left and right pulmonary arteries. The left and right pulmonary veins carry oxygenated blood from the lungs to the left atrium, and the oxygenated blood is pushed by the left ventricle into the aorta. The right acute border of the heart is formed by the superior vena cava, the right atrium, and the inferior vena cava, as indicated by the blue arrows. The left obtuse border is formed by the left ventricle, which is also indicated by the blue arrow. The sulcus terminalis is a groove on the external surface of the right atrium, and it corresponds to a ridge on the internal heart surface, which is known as the crista terminalis. The coronary sulcus is a groove on the external surface of the heart, which marks the division between the atria and the ventricles. Before diving into the internal anatomy of the heart, let's take a look at how the blood circulates through the heart. Deoxygenated blood from the systemic circulation reaches the right atrium through the superior and inferior vena cavae. From there, the blood enters the right ventricle when the tricuspid valve opens. The pulmonary semilunar valve opens when the right ventricle contracts, and blood is carried by the pulmonary artery to the lungs for oxygenation. Oxygenated blood from the lungs reaches the left atrium via the pulmonary veins, and when the left atrium contracts, the bicuspid or mitral valve opens and blood enters the left ventricle. On contraction of the left ventricle, the aortic semilunar valve opens and the blood is ejected into the aorta and into the systemic circulation. And the cycle goes on. Moving on to the internal anatomy of the heart. Let's discuss the internal anatomy of the right atrium first. The right atrium has an anteriorly situated, rough-walled atrium proper lined with pectinate muscles, and a posteriorly situated, smooth-walled sinus venerum which receives the superior vena cava, the inferior vena cava, and the coronary sinus. The right atrium contains the valve of the inferior vena cava called the eustachian valve, and the valve of the coronary sinus called the Thebesian valve. The sinus venerum is separated from the atrium proper by the crista terminalis, which is a vertical muscular ridge running anteriorly along the right atrial wall from the opening of the superior vena cava to the opening of the inferior vena cava, providing the origin of pectinate muscles. The fossa ovalis is an oval-shaped depression in the interatrial septum, and it represents the site of the foramen ovale through which blood runs from the right atrium to the left atrium before birth. The right ventricle makes up the major portion of the anterior surface of the heart. It contains trabeculae carni cordis, which are anastomosing muscular ridges of myocardium. The right ventricle has three papillary muscles, that is the septal papillary muscle, the posterior papillary muscle, and the anterior papillary muscle. These cone-shaped muscles are enveloped by endocardium, and they contract to tighten the chordae tendineae, thereby preventing the cusps of the tricuspid valve from being everted into the atrium. The conus arteriosus is the upper smooth-walled portion of the right ventricle, which leads to the pulmonary trunk. The septomarginal trabecula, also known as the moderator band, prevents the overdistension of the ventricle and carries the right limb of the AV bundle from the septum to the sternocostal wall of the ventricle. The interventricular septum separates the two ventricles and is the place of origin of the septal papillary muscle. It is also a common site for ventricular septal defects, or VSDs. The pulmonary valve has three cusps, namely the anterior, right, and left semilunar cusps. The tricuspid valve also has three cusps, that is the anterior, septal, and posterior cusps. The left atrium is positioned behind the right atrium and has smaller and thicker walls than the right atrium. The walls of the left atrium are smooth except for a few pectinate muscles in the left auricle. Posterior to the left atrium lies the descending aorta and the esophagus. The left atrium shows no border on a postero-anterior radiograph since it is positioned behind the right atrium. The left atrium receives oxygenated blood through 4 pulmonary veins. The left ventricle is divided into the left ventricle proper and the aortic vestibule, which is the upper anterior part of the left ventricle that leads to the aorta. The left ventricle contains 2 papillary muscles, anterior and posterior, with their chordae tendineae and a meshwork of muscular ridges called the trabeculae carni cordis. The left ventricle performs harder work, has a thicker wall, and is more conical shaped than the right ventricle. The bicuspid valve is known as the mitral valve because it is shaped like a bishop's mitre. The valve has 2 cusps, that is the anterior and the posterior cusp. Let's take a look at the areas on the chest where the heart valves can be auscultated. The aortic valve is most audible over the right second intercostal space just lateral to the sternum. It is closed during ventricular diastole and causes the second heart sound. The pulmonary valve is most audible over the left second intercostal space lateral to the sternum. It is opened by ventricular systole and shut slightly after closure of the aortic valve. The tricuspid valve is most audible over the left fourth intercostal space lateral to the sternum. It is closed during ventricular systole and causes the first heart sound. The mitral valve is audible at the left fifth intercostal space at the midclavicular line. It closes slightly before the tricuspid valve and causes the first heart sound. The cardiovascular silhouette, or cardiac shadow, is the contour of the heart and the great vessels seen on a postero-anterior chest radiograph. The right border is formed by the superior vena cava, the right atrium, and the inferior vena cava. The left border is formed by the aortic arch, the pulmonary trunk, and the left ventricle. The inferior border is formed by the right ventricle. The left atrium shows no border on a postero-anterior radiograph.